Good morning, everyone. As you're coming in, if you wouldn't mind chatting in your name and your agency, we would appreciate that. We will get started in just 1 minute. All right, let me go ahead and begin. Thank you, everyone, and welcome to our Trauma Awareness Month webinar on Blueprint for Trauma-Informed Higher Education. It's presented by the Higher Education Working Group, which is one of the 3 working groups under the umbrella of Trauma Matters Delaware. I'm Deb Berkey. I am Director of Psychology Programs and the Center for Prevention Science at Wilmington University. I am also co-chair of this working group, and I am the Trauma Matters Delaware Board Vice President. We have a wonderfully diverse audience here with us today. We have representatives from higher education institutes across the state of Delaware, as well as around the U.S. We also have individuals from Delaware state government and those from social service agencies. So it's really exciting to hear, to see all the different voices represented in the room today. Today, our goal is going to be ensuring that we're all on the same page in relationship to what we're going to be talking about. So we're going to start out by reviewing some basic information about trauma and toxic stress and how they might impact students, faculty, and staff in higher education. We'll think about or talk about what it might mean to be a trauma-informed college or university and how our colleges and universities might create a trauma-informed workforce. Last but not least, we're going to touch on what it means to implement trauma-informed educational practices within higher education. As we go along throughout the webinar this morning, we welcome your insights, which will help inform our blueprint. So again, thank you all for coming. This higher ed working group, next slide, Deshawn, is a collaboration of many institutes within the state of Delaware, as well as a representative from the University of Pennsylvania, and you'll see all our logos here. And it's been a pleasure to organize this group and to oversee the work of this group to date, and look forward to our continued collaboration. We do have a couple of ground rules that we call our community agreement that we would like to review before we start digging into the information. We do kindly remind you, if you don't mind, please muting yourself when you're not speaking, so we can avoid unwanted interruptions. We strongly encourage you to use the chat function for engagement, to ask questions, to post comments. We'll be monitoring it as we go along, and if we can't get to your question or comment today, trust me, we will review it and respond accordingly. And then we also welcome you to connect and enjoy the content, and we will give you opportunities to connect. And also, as a reminder, today's webinar is being recorded, although once we go into breakout rooms, which we will in a little bit, those will not be recorded. So only the main room will be recorded today. With that said, I'm going to turn it over to Marilyn Siebold, who will take us through what we're going to be talking about in terms of trauma and toxic stress. Marilyn.
I'm sorry, I need to unmute myself. Okay. So what we're going to do is today we're going to talk a little bit about trauma and toxic stress and how those terms are kind of used interchangeably, and there's some similarities about using them both. We're going to talk a little bit, and this is going to be a real collaborative learning, so we want to hear from you as well, and you're going to have a chance to do that as well. We're going to talk a little bit about what it means to be trauma-informed, And then finally, we're going to talk about why it matters to be trauma-informed, especially in terms of higher education. It's wonderful that so many people here in this audience are associated with colleges or universities in Delaware and elsewhere. And if you're not specifically associated with an institution of higher education, that's great, because I'm certain that you've either been at an institution of higher education, you have family members or friends who are associated with colleges or universities, either as students or faculty. A trauma-informed approach to higher education matters for all of us, whether you're a faculty member, or staff, or student, or have family and friends in colleges and universities. So that's why today's program is going to really focus on why it matters to be trauma-informed in higher education. So if you could go to the next slide, please. So what we're going to do first is just do a little bit of, I think, self-awareness for all of us. So we're going to ask you, we have a very short question, and what do you know, or what have you heard about the trauma-informed approach? So just the one question we have is, I'm familiar with the impact of toxic stress and trauma-informed approaches. So if you can just take a minute or so to tell us a little bit about it. Okay, see the answers are coming in. And I'm going to defer to the person who is doing the polling to let me know when we should stop sharing the results. I guess probably.
Sure. You want to comment at all on the results?
Sure, yeah, I do. Yeah, so let me do that. So this is terrific. It looks like many people are very familiar with the impact of toxic stress and trauma-informed approaches. And a lot of folks are somewhat aware of it. So whether you know anything about it or not, or somewhat or not, excellent. So I really we all really look forward to hearing from you, especially when we have the breakout rooms and start talking about how to apply the trauma-informed approach to institutes of higher education. Thank you, thank you, thank you. So I guess the next slide, please. Okay, good. So I'm just going to. So what do we mean by toxic stress or trauma? So I want to be really clear that when we are in this group here in our time today, we're really talking about toxic stress and trauma, you know, not as a clinical diagnosis, not as PTSD or any clinical diagnosis. We're really going to be talking about toxic stress as an injury that as an emotional injury to all of us that leaves people and communities feeling powerless and hopeless, and they may not have the coping skills to really deal with it. So again, think about trauma. If it's helpful, think about trauma as a toxic stress that really gets in the way of people and institutions and systems and communities, gets in the way of their functioning at their highest level. Yeah, so, okay. So what I want to talk about for a few minutes are the adverse childhood experiences. Maybe some of you are have heard about the ACEs study. If not, I kind of think it's the really, really one of the most important studies that people haven't necessarily heard of. Really quickly, this was a landmark study that was done in California by the Kaiser Permanente healthcare system. This was in the 1990s, and essentially there was an assessment done in primary care settings about how adults reported their childhood experiences. The amazing thing was that with this ACEs study, so adults were asked, and it gets in self-report. So this is a correlational study. Adults were asked to reflect on and think about up 10 different examples of childhood experiences that we would say are traumatic. Now, 5 were kind of personal. They had to do with, abuse or neglect in their background. The other 5 of the 10 kind of dealt with experiences of living in the family. What was so amazing about the ACE study, which has been replicated over the years throughout the country, and the similarities were, and the results of these studies were very similar, that a significant percentage of people report these adverse childhood experiences. But what's more important is that there is a correlation between having a certain number, and I hate to say it's a score because it's not a test. It's a way, the ACEs study is a way to really think about who we are ourselves in our community. But there is an amazing correlation between an increase in adverse childhood experiences and adults reporting very serious healthcare issues and diseases. So what we found was just, for example, and it's a risk factor. So there is absolutely a risk of having more adverse childhood experiences and experiencing, it actually doubles your risk of, say, having cancer or heart disease. It quadruples the risk of, having some lung diseases, autoimmune diseases. Please pay attention to ACEs when you hear about an adverse childhood experience study in your community. But in addition to this, we also now think about adverse community experiences that put people at risk of living to their full potential. And I like this graphic here because number 1 is that tree, and those were the criteria that are used in ACEs surveys for individuals. But look at the adverse community experiences that are so prevalent. Lack of jobs, historical trauma, food scarcity, being exposed to poor water and poor air quality. And in addition, we are at risk with all those kinds of environmental situations. So, the takeaway about this is that adverse childhood experiences, adverse community experiences increase the risk that we will have that leads to less successful outcomes when we are adults. And they have to do with physical conditions, but they also have to do with our capacity to be successful in learning. Can I have the next slide, please? Thank you. So one of the things that we want to what's really important is we want to talk about stress, okay? Now, people, all of us, are continuously, constantly exposed to stressful situations. So we know that. Now, there's some stress that's good. You know, we know that stress is a biological response to things that happen to you, to how you perceive what's happening to you. Okay, so if you perceive a situation that is stressful, a part of the brain called the hypothalamus is going to respond to that stress response. And so we know that when there's positive stress, and some stress, you know, might be good. So, you know that you're going to be, engaging in some kind of sporting competition, or you're going to be taking a test, or you're going for a job interview. Well, it's stressful, but it's positive stress. And you know why it's positive? Because your brain is saying, oh, there's a stressful situation. It's going to increase your heart rate. There'd be mild elevations of stress hormones, such as adrenaline and cortisol, and you're going to do great on that job interview. You're going to do great on that test, you know, so that's positive stress. Now, tolerable stress, it's a little bit different. This is sort of still serious, but temporary stress responses. So, tolerable stress situation might be that, you know, you did really well in a job interview, you have your new job. So the tolerable stress is, you need to figure out how you're going to succeed in this new work environment. But toxic stress is different. So toxic stress is a kind of stress that is a prolonged activation of the stress response. And and you don't have any supportive systems to protect you. And that is where the biology of toxic stress or trauma comes in. So could I have the next slide, please? I want to talk just a little bit about that. All right. So this is not going to be a whole series of information about the brain, but it's really important that you understand this. When we perceive a stressful situation, okay, part of the brain, the hypothalamus, begins the stress response. So two things you probably heard of, you know, these, the responses are adrenaline and cortisol. So adrenaline, you know, is the chemical that increases your heart rate, elevates your blood pressure, boosts your energy supplies. So once in a while, you know, a little bit of adrenaline is good. Cortisol is a primary stress hormone that increases the sugar in your bloodstream and enhances your brain's use of that glucose or sugars. And for short term, it is helpful. Now, you know, in our life, most of us, we don't have the kinds of life-threatening situations that our brain is sort of geared to protect us from. So we're able to replace some of those threats we perceive with different reactions. But many of us, modern life still leads to life-threatening situations. And when stressors are always present and you always feel you're under attack, you've heard of the fight, flight, or freeze response. When you are always feel that you're under attack, the fight or flight reaction starts going. And when you feel like you're always under attack, the reaction is, you know, anxiety and depression, but also memory and concentration impairments. So could I have the next slide, please? So when we feel that we're under attack, something happens to our brain and we feel like we're in the survival brain mode. Now, sometimes it's hard to know when you're in the survival brain, so I'll tell you how I can sort of tell. You may have a lack of focus. It's hard to concentrate. Things seem maybe foggy. You have trouble finishing one activity in a focused way. You'll have changes in memory. You may have a hard time remembering situations. Fatigue. You feel a lot more tired in body and mind. Emotionally reactive. You find yourself being more upset about things that you ordinarily react to. And you're more impulsive. You might engage in activities that you wouldn't do in usual conditions. Many, many people today, or right now, many people are living in survival brain more than ever because changes to our routine. Think about living in the last 12 or 14 months of the epidemic. We have changes to our routine, disruption in school, disconnection from our family and friends, our loss of loved ones, emotions from civil unrest, experiences with racism, bullying, and financial unknown. These are all the stressors that can dim the thinking brain and make us move into the survival brain. And it's that survival brain that is really impacting anybody, so students and staff in higher education. And I guess I will now turn it over to Leonora.
Thank you, Marilyn. Next slide. So we're talking a little bit about the survival brain, and I think it's a good transition right now to move on to triggers. My name is Leonora Ruffin, and I'm the Assistant Dean for Career Development at Widener University Delaware Law School, and I'm pleased to be here today. You know, when you think about the survival brain, it's important to remember with someone who has a history of trauma, being around anything that reminds that person of a traumatic experience, otherwise known as a trigger, can make them feel like they're going through that traumatic experience again. So it's important for us to really understand what a trigger could possibly be. And we have here on the slide a brief description of what that is. A trigger prompts a negative emotional reaction before a person even realizes what happens. But everyone has their own history, right? So triggers are unique. Generally speaking, they could be anything like certain words, tone of voice, body language, sounds, smells, anything that's activating that brain's early warning system that Marilyn was referring to, that survival brain. In the educational setting, we need to be looking at what can we do to make sure that our environments are not re-traumatizing students or triggering students, or even ourselves, right? Because it's not only just about the students, it's also about what's happening to us as faculty, as staff, as clinical directors, anyone really who is in the environment. I think it's important to remember triggers has become such a popular word nowadays. I feel triggered. I hear that, you know, maybe 2-3 times a week. But triggering is something different than just feeling bothered by something. Or there's a difference between being triggered and just feeling uncomfortable. So we want to really make sure that when we're talking about triggered, at least in this sense, that we're understanding what that means. And then obviously we have here a point out to the fact that triggers can come from us internally, or they can be externally. So can I have the next slide, please? So what about you? What activates your survival brain? I know working in higher ed, particularly this last year for me, there have been several times where I've thought, I'm not moving in the same way that I used to. I'm not sort of interacting with people, with students, with my colleagues in the same way. And that has had, you know, consequences. Some have been good, but some have been, you know, a little bit problematic, I think, as I've moved through this season for a year. When we think about what's going on for students in particular, you see that there could be plenty of things that are triggering them. Think about just a typical classroom situation, the closed door, the confined space, the one-on-one counseling appointments that you have. I know I work in career services, and so, most of my interactions are one-on-one in a closed space, often a small space. But it could be a content of a conversation. Maybe you work in student services, or maybe you work in another space and you're talking to a colleague and the tone is a little bit off that day. You may be impacting your coworker, you may be impacting those students. Um, Speaking about student services that deals a lot with accommodations, what would it mean to have an inadequate accommodation for a student or someone who's living with a disability? That could be a triggering moment. And again, we talked about body language or voice tone. So just start to think about, and we'll talk a little bit more in the breakouts about what are some of these common triggers that seem really little on the surface, but could have big impacts and re-traumatization effects on really everyone in the community. Next slide. So lest we think that we are talking about someone else, we wanted to include a little bit about some of the stats. And these are about Delaware adults who have experienced one or more ACE in their lifetime. It was in 2015. And at that time, there were 44.1% of adults taking this particular study who reported that they had 0 ACEs. So that's great. But the majority had 1 or more. And as Marilyn was suggesting, that has a lot of public health implications. I guess the big takeaway for me when I look at a slide like this is to know that ACEs are prevalent. Our students, our faculty, our administrative staff are likely, more likely than not, dealing with them. In the United States, it's estimated that more than 2/3 of the population has at least one ACEs that they're dealing with, and it could be showing up in their health right now. When we look at Delaware in particular, we know that certain communities are more impacted than others. So we know that it's more common in Delaware for women. We know it's more common for low income individuals, people who have minimal education, and certain racial and ethnic minorities. In 2018, a similar type study done by the University of Delaware Center for Drug and Health Studies indicated that 50% of Delaware adults reported exposure to 1 or more ACE. So these are people that we are working with. These are people who are with us every day. Next slide, please. Digging down more into the trauma exposure and experience for college students or students working in a higher, studying in a higher education environment, this first statistics, which says 66 to 85% of youth report lifetime traumatic event exposure. That's a lot of people. And many of them are talking about more than one. So for me, that really shifted something for me to know that it's not just the isolated instance. We're having more and more people who are being affected by these traumatic exposures. And it's likely, given living and working patterns, that they're maybe working with us and around us. But this next bullet point here, which talks about college students who are particularly vulnerable, I think should give us all pause. It says here, as many as 50% of college students are exposed to a potentially traumatizing event in the first year of college. So what will that mean to really take that in and understand that? What will that mean when we're planning orientation? What will that mean when we're going through, just establishing curriculum? What will that mean in terms of interacting in the hallways? If you really took that to heart, that number, more than 50% at risk for an additional PTE or potentially traumatizing event, you can see the need to shift things in the maybe the way that we are currently interacting with students, staff, and faculty. Next slide, please. So this is why it matters, right? This is why it really matters. We need to understand how trauma is hindering learning, engagement, motivation, and success. If we do that, we'll be able to strengthen the kinds of relationships and create the safe spaces to support learning and the well-being of everyone involved. And so now as we turn this conversation to really dig into trauma-informed approaches at higher institutions, I really want to encourage you to get your thinking hats on and be setting yourself up to go into the breakouts where you'll be digging into this even more. I would really like to thank you for your attention, and I'd like to turn this over to Michelle at this point.
Good morning, everyone. My name is Michelle Wark, and I am the Human Services Department Chair at the Owens campus of Delaware Technical Community College. I'm going to ask you to really put your thinking caps on and to start really helping us to look at potential blueprints for how higher ed can address trauma-informed environments. So what I'd like for you to do, if you are not already, is consider exiting full screen so that you can open the chat and be able to see both the slide and the chat at the same time. If you need help doing that, you can just move your cursor to the top of your screen, click view options, and you can exit full screen from there, and then open the chat with the chat button at the bottom. And while you all do that so that we can use that chat function, we're going to talk about the 4 R's of trauma-informed care. The 4 R's was adapted from work by SAMHSA, the Substance Abuse and Mental Health Services Administration, in 2014. So this is not a new understanding of how to do things, but I'm going to add the new caveat at the end. We start, of course, by realizing that trauma happens and that it is widespread. And as Leonora discussed a few moments ago with the statistics that were quoted, the number of folks who are impacted by trauma. I would love for you to use that chat function now to give an example of something over the last 1.5 years while we've all lived through a global pandemic that may have created trauma. And we'll kind of keep an eye on that while you're doing that. In addition to just realizing that trauma is widespread, isolation, thank you. I see a lot of that coming up. Racial unrest, thank you. Loss of jobs, financial burdens. Thank you all for participating. I'm seeing great stuff coming up. We're all taking a look at what has happened to all of us, our entire world, over the last 1.5 years. And you are paying testament to why it is important to understand trauma. We recognize the signs and symptoms of trauma, and you heard Leonora also talk about that in her discussion of triggers. Exposure to COVID, deaths of friends. I'm seeing more and more coming up in the chat. Racial inequities, political trauma, absolutely. Social upheaval. Students who have never met each other, thank you, and are trying to engage and interact in group assignments. Food insecurity. How many of us have paid attention to the food pantries and other local offerings and what colleges are now doing to try to serve the needs of their students after finding out that many of them were food insecure? When we recognize the signs and symptoms, and Marilyn talked about this in terms of survival brain and what happens to us when we enter that mindset, then we must, or we are behooved to respond in a way that is trauma-informed, to recognize and think about our policies, our practices. There's been so much discussion in higher ed groups about requirements to keep cameras on during Zoom meetings and videos, and how that can be potentially traumatic for many students. I'm seeing mental and emotional trauma. We have all heard and read in the news about the pandemic's impact on mental health and how many people are feeling isolated and seeking services, and that we just don't have enough services to provide for folks. Resisting re-traumatization. We want to think about those triggers that Leonora talked about and our practices in the classrooms. Sherry, we all know about the great TP shortage of 2020, and we'll be talking about that for the rest of our lives. Thank you. It's always good to have a joke. You know, having the opportunity to really look at both our own perspectives and to look at our practices and policies from a trauma-informed perspective, to really look outside of academia and look at what might be the best way to interact with others. And I think Marilyn used the word connection many times in her conversation, and creating connection. The first thing that came up when I asked you to talk about things that cause trauma was isolation. And it came up over and over and over and over, because we have been isolated from each other in many, many ways. So creating connection. There's been lots of talk about how it's difficult to move forward now. And that's where building resilience comes in. And that's our last R. Next slide, please. The 6 principles of trauma-informed approaches. I know from our poll that many of you have likely seen these before. And I so appreciate that we have your expertise here and that you will be able to help really to frame the conversation in a way that is informed. You know, trauma-informed is really about reducing the experience of threat and restoring the capacity to problem solve, to think, to plan, to behave logically and rationally, to take things without entering that survival brain where everything feels surreal and uncomfortable. In February 2018, as most of you know, federal law was passed requiring government institutions to become trauma-informed. In October of 2018, Governor Carney signed an executive order at the state level requiring all state organizations and institutions to become trauma-informed. And the birth of this came about. When we look at the principles of trauma-informed approach, please consider, of course, the first thing that always comes to our mind is safety, but not only physical safety, psychological safety as well. Is it safe to have a conversation in your classroom? Is it safe to have a conversation in your work area? Is it safe for employees to talk to each other about things that might be going on for them? Trustworthiness and transparency. Do organizations do what they say they're going to do? Are they transparent in their processes? Peer support. What opportunities do we have to support each other? And what opportunities are provided for students to support each other, to gather, to connect? And there's that connection piece again. Collaboration and mutuality. What opportunities do we have for everyone to play a role? And your role is about to get a little bigger as we go to the breakout rooms coming up. So bear with me just a second. One of the last comments about the trauma that has occurred over the last year and a half was that of mass shootings. When we're looking at the connection between people and we are looking at trauma, imagine the trauma created by children or students, adult students, who are participating in active shooter drills. Empowerment, voice, and choice. The opportunity to be able to direct ourselves in a way that feels safe and secure, having the ability to talk about what's going on with us. And finally, cultural, historical, and gender issues. We certainly know that our society has not yet reached equity. We are working toward that, and I hope that everyone here today is doing that. Would you mind in the chat, please telling us what you personally or your institution is doing to encourage equity? Next slide, please. I don't know if the chat silence is something that I should be concerned about. I started to worry that maybe my internet had frozen. So please keep thinking about that equity question. There we go. Thank you, Celeste. Wonderful. Thank you. Advocacy, giving voice to others, the trauma-informed principle. Providing staff training to understand, wonderful. Meditation training, excellent. Polls and surveys, getting data and finding perspective. Providing resources, wonderful. As you continue to share that, I'd like you to really be thinking about that. We are getting ready to go into our breakout groups. You have been pre-assigned to a breakout room and you will be seeing the little button to join in just a minute. The breakout rooms are each numbered for one of the 6 principles. So that slide that was just up with those 6 principles will be what the numbers that you can focus on. Sorry, mouth work. The numbers that you can focus on in order to lead your discussion. We have 15 minutes available for discussion. Some considerations to help guide your conversation are listed on this slide. I'm certainly not going to read them to you. This is what I would like for you to think about. Some of you work in higher ed. Some of you do not. Some of you work with folks who are participating in higher ed. Some of you have a firsthand experience with higher ed. But right now, we would like to leverage your lived experience, to leverage your understanding, to really look at if you could create a blueprint for the future of higher education using the 6 principles of trauma-informed approaches, how would you do that? Once you're in your breakout rooms, we will ask you to please identify a reporter. There will be a link to a Google form so that you are able to record your conversation and we can follow up and get information about what everyone is discussing. When we come back to the main section, we'll have an opportunity to have just a little bit of report out and conversation before we wind up. Danielle, thank you. If you look in the chat, you'll see the link to the Google form that has popped up.
And Michelle, we have a slight change in our strategy. Rather than being pre-assigned, they will go automatically into groups, but your group will be allowed to pick which of the 6 principles you'd like to discuss.
Wonderful.
Indicate that to us on the form. And they will have approximately 10 minutes for discussion in their groups.
Thank you, Deborah. So thank you. And we're all going to be flexible and work with how things are going. So 10 minutes for discussion. The principles are in a Word document that was sent by email yesterday as well. Okay, so we are going to be going into our breakout rooms. Please, when you see the little join button pop up, click. Everyone, I know that we are all rejoining from our breakout rooms, and I will ask you to again exit full screen because it may have gone back to full screen when you came out, and to open the chat function back up. I don't know about everyone else, but in my breakout room, we did not get done. Talk about it. We did not get there. So I would like you to really exercise that chat function right now and tell us what was the topic of conversation? What did you really engage in? I see, thank you, Clarence and Lisa. I see that you guys didn't get done either. And I get it. I want to keep us on time and make sure that that we are moving along, but I really want to hear what you talked about. So if you will put in that chat function, please tell us what you were talking about. And I'd like to share that one of the things that came out of our conversation was that it was really wonderful to have folks who were not higher ed in the room talking about barriers and things that might come up from a different perspective. Please use that chat function to talk. I know that we are moving along. Thank you so much. And I'm going to turn it over to Dr. Berkey so that she can get us closed up.
Thank you, Michelle. So in our remaining 1 minute, I'm going to highlight some of the outcomes that we hope, and the why again, that we believe that this trauma-informed, healing-centered, resilient learning environment recognizes trauma and understands triggers, that it helps individuals regulate emotions and control impulses, has individuals who are aware of trauma and triggers, demonstrates compassion for self and others, empowers us to perform at our ultimate peak, hopefully, and learn, and then recognizes and acknowledges strengths in individuals. So this is the why. This is the so what. Why should you do that? This webinar has been recorded. You will have access to the slides. Next slide, please, Deshawn. We will be sending these out within the next day or so. If you would like more information, here is contact info relative to Trauma Matters Delaware or the Higher Education Working Group in the Blueprint. And again, you will get these slides with these links in just a day or two. Next slide, please. And for your information, we do have 2 more events happening. The first one, Towards a Community of Healing public webinar, is next Wednesday at 10 a.m. That is open to the public. And then there's also a state agency summit where the Delaware state agencies will be reporting out. That is only open to if you work for a Delaware state agency, but we highly encourage you to register for the Community of Healing webinar, and that link will be in the email that you'll receive in the next day or two. So again, thank you to our presenters. Deshawn, you will see on this slide myself, Leonora Ruffin, Marilyn Siebold, and Michelle Work. We truly appreciate your being here with us today, and we look forward to our continued conversations around trauma, toxic stress, and higher education. Thank you again.